Today we're going to do a bipedicular approach with the Zavation ZVplasty System. There's a difference between the unipedicular and the bipedicular approach, which is essentially we're duplicating the number of instruments that we use to access the vertebral body. We have the same number of Jamshedes, we have 2 inflation balloons, and we have twice as many delivery tubes for the cement. Initially going to access the vertebral body from the left side and then go to the right side. Essentially what we're going to try to achieve is to localize our entry point where we can make the incision in the skin. As you can see, my instrument is just to the lateral aspect of the pedicle, and we're going to make an incision about 1 finger breadth lateral to that point. Lateral. Okay, let's go to 8 feet. After we've made the skin incision, which is about 1 finger breadth lateral to the pedicle, we place the Jamshedi in through the skin and position it to the lateral aspect of the pedicle from the AP standpoint. And we'll look at the lateral next. And you can see that the Jamshedi needle has a trajectory through the vertebral body and it's above the foramen. So at this point we're going to adjust the trajectory to get the Jamshedi into the vertebral body, maintaining its position within the pedicle until we reach that junction between the vertebral body and the pedicle. Excellent. Again. At this point you can see that the needle is within the vertebral body. We stayed within the pedicle from our trajectory, and we're going to advance the needle to a point where we can then drill and place the balloon inside of the vertebral body. X-ray. I'll remove the inner trocar of the Jamshedi, and we will begin the process of drilling to our endpoint to the anterior third of the vertebral body. Now that should give us plenty of room to place the balloon from this side of the approach. So I'm at this point going to remove the drill, and I'm going to pass one of the balloons into position. X-ray. Again. So the balloon is in position on the left side, and what we're going to do is begin the process of positioning the balloon on the right. Normally what I do is leave the balloon in position, but I do not inflate the balloon, because as I come in from the contralateral side, I will be using a drill, and I do not want to have the drill puncture the balloon. So I use the balloon in its position, uninflated, to provide some hemostasis while I'm accessing the contralateral side. So again, we'll begin the procedure by doing an AP to find the lateral aspect of the pedicle on the contralateral side. So as you can see, the tip of the Jamshedi is at the lateral aspect of the pedicle. I'm going to make my incision about 1 finger breadth lateral to that position. Again. Again. Let's go to an 8 feet. Lateral. Okay, at this point we have the second jam sheety positioned at the lateral aspect of the pedicle at the pedicle transverse process point. And on the lateral view, we can see the trajectory of the needle is heading towards the same trajectory as the contralateral side. What we'll do at this point is advance the jam sheety to obtain the same trajectory as we have on the contralateral side. Okay, let's go to AP. As you can see on the AP view, the tip of the jam sheety is at the mid portion of the pedicle as we're traversing our way in towards the vertebral body. And we'll continue to do the advancement from the lateral x-ray. Again. Okay, at this point, the tip of the jam sheety is in the posterior aspect of the vertebral body, and from the AP we could tell we were towards the middle portion of the pedicle, so we're in a safe zone where we're not going to cause any problems with breach into the spinal canal or a breach into the neural foramen. So at this point I'm going to advance the jam sheety a little bit further, and then we will proceed with drilling to our target using the hand drill. And again, this is the reason I do not inflate the balloon on the contralateral side, because we're drilling on this side. We do not want to disrupt the balloon. So we will begin the process of drilling to our target. And as you can see, the tip of the drill is pretty close to the same depth as the balloon on the other side. As you can see, they're relatively well lined up, but what you can see is the tip of the radial opaque marker that's proximal and distal on each balloon. Now at this point, I'm going to sequentially inflate the balloon. I inflate a little on the left, a little on the right, until I can reach maximum inflation in the system without exceeding the pressures. So I'll begin that process now. So that's one balloon that's starting to inflate. That's the one on the right side. And I'm going to begin the process of inflating the balloon on the left. And you can see the balloon on the contralateral side beginning to inflate. It's difficult to tell, but you can actually see the balloon has elevated the end plate of the fracture, which is one of our objectives of the procedure. And I think this represents a relatively good film for this level of fracture. So at this point, I'm going to begin the process of mixing the cement. Normally what I do is I leave the balloons inflated until I'm ready to begin infusing the cement. It reduces the amount of blood loss from the procedure. A lot of times patients that have osteoporosis, the low bone density allows for a lot of bleeding, and this helps minimize that process. So at this point I will deflate the balloons and remove the balloons from inside of the vertebral body. The next step in the procedure is the mixing of the OsteoFlex cement. This has three components. There is the cement powder, and there is a metal ball inside. There's the liquid catalyst, and what we want to do is pour the liquid into the container. Replace the cap and shake for 15 seconds. You let the bowl do the mixing. Now we're filling the transfer syringes with the cement. Once we have the syringes filled, we'll need to wait 3 to 4 minutes for the viscosity to set, and then we can commence with infusing the cement into the vertebral bodies. Now I'm beginning the process of filling the bone fillers. Each bone filler holds 0.9 cc's of cement. At this point, we want to make sure that the cement, after the several minutes of setup time, has a consistency of toothpaste. And as you can see, it's somewhat firm but not completely solid. This makes a good consistency for us to use for the procedure. When I'm doing a bipedicular approach, I normally put the inner trocar of a jam sheety in place while I'm filling the contralateral side, because there's often a communication between the voids, so we want to prevent cement from going in one side and coming out the other tube. So you will put the inner trocar in the contralateral side of the jam sheety to prevent the cement from coming out the other side. So we'll begin filling from this side. Excellent. Again. And as you can see, the cement is beginning to fill the void. Now I'm going to do an AP to see if the cement's moving to the contralateral side. Okay, and we can see that it's not moved to the other side. We'll go back to a lateral. I'm going to add more cement on this side, and then we're going to move to the other side to begin filling cement. Lateral. Okay. Now what I'm going to do is move the jam sheety to the contralateral side and begin filling on the contralateral side. Extra. Again. Let's do an AP. Go to a lateral. Again. Again. And AP again. And lateral. So for this type of fracture, I think that's an adequate amount of cement into the void. What we're going to do at this point is put both inner trocars in to let the cement set. What we don't want to have is any of the cement coming up through the pedicle, creating a tail. So we'll leave that in place for a couple of minutes, and then we can remove both trocars. This is an example of a bipedicular approach of the Zavation ZVplasty. We got adequate fill bilaterally, and this should help a lot in your patients who are having pain from a subacute or acute compression deformity. Thank you very much.